New alarm tonight from the CDC about an outbreak of the West Nile virus, more widespread than they have ever seen before. The virus has now been detected in 43 states. It is carried by mosquitoes. So what is the first sign that you're in trouble? Here's ABC's Ryan Owens from Dallas, where they've declared a state of emergency tonight.
It feels like somebody has lodged an axe in my brain.
If you think West Nile virus only affects the elderly and unhealthy, meet Catherine DeVille. She's 42, mother of an 8-year-old, and in good health. At least she was until a mosquito bit her last month in her backyard outside Dallas.
Just about the time I think I'm out of the woods, then something else comes along and we have to fight that too.
You have felt miserable for more than 2 weeks.
I have.
That one mosquito bite has left her first with a fever of 104 and now with meningitis and encephalitis. Dallas is the epicenter of this epidemic. 1/4 of the country's cases are in this one county. Most people with the virus never know they have it. Roughly 80% have no symptoms. 20% suffer from some combination of high fever, headaches, joint pains, vomiting, and diarrhea. Only about 1% develop the neuroinvasive form of the disease that attacks the brain and spinal cord and can be fatal.
We're starting to see some younger people get neuroinvasive disease, and that's a little bit unusual.
Communities across North Texas have been spraying pesticides every night, and some will soon start controversial aerial spraying.
I don't want anybody to get this. So if it means that they have to go and spray from the air, do it.
Doctors say Catherine will recover, but she's already missed her daughter's first day of school. After a summer here, few will forget. Ryan Owens, ABC News, Dallas.
And I want to bring in ABC's medical editor, Dr. Richard Besser, spent much of his career tracking diseases with the CDC. So 400 people have already had the most severe consequences. What are we going to do about this?
Yeah, I mean, it's very serious, and there is no treatment. So the key here is really all about prevention. And when you talk about prevention, the key is fight the bite. If you don't get bit by a mosquito, you're not going to get this disease. And the woman that we saw in this story, it doesn't always go away. 60% of people continue to have those neurologic symptoms for as long as 5 years.
And where does it come from?
Well, the mosquitoes get it from birds. It's carried by birds around the country. The mosquitoes bite the birds, get it, and then they bring it to us. And it's people who are over 50, who are healthy and active, they're outside, who are most likely to get the most severe kind of West Nile virus.
And again, it's fever, very high fever.
That's
and
right.
aches.
Aches, it'll seem like you have the flu. And if you've got the flu and it's in an area where there's West Nile circulating, it could be this disease.